Hello guys, I'm Deepak Shukla. Welcome to our channel Study Mania. Today let's learn about atrophic rhinitis. Atrophic rhinitis is chronic inflammation of nose characterized by atrophy of nasal mucosa and turbinate bones. Okay, atrophy of nasal mucosa and turbinate bones. Here, nasal cavities are roomy and full of foul-smelling crusts. Okay, coming to the types of atrophic rhinitis, we have primary atrophic rhinitis, secondary atrophic rhinitis. In primary atrophic rhinitis, the cause is not known, but in secondary atrophic rhinitis, the cause is secondary to some infections like syphilis, lupus, leprosy, rhinoscleroma, radiotherapy to nose, or excessive surgical removal of turbinates or severe deviated septum. Okay. So coming to the primary atrophic rhinitis causes, the cause is not known, but there are various hypotheses that have been put forward. So here we can learn it with the mnemonic hernia. Okay, hernia. H stands for hereditary. So more than one member in the family are affected. We can think of primary atrophic rhinitis. E stands for endocrine. The disease starts as puberty, involves females more than males, and the disease tend to subside after menopause. Okay, so something related to endocrine. Then racial, R stands for racial. Okay, then nutritional deficiency, vitamin A, vitamin D, and iron. Okay, so this can also be a cause for atrophic rhinitis. So while giving treatment, we have to keep these things in also mind. Then we have infective causes. In infective causes, we have Klebsiella ozynae. Very important. Klebsiella ozynae. This is also known as Paris bacillus. Okay. Comment in the box what is Frisch bacilli causing. Then A stands for autoimmune. So in hernia, H stands for hereditary, E stands for endocrine, R stands for racial, N for nutritional, I for infective, and A for autoimmune. Okay. So these are the causes for the atrophic rhinitis. In secondary, we have syphilis, lupus, leprosy, rhinoscleroma, radiotherapy, excessive resection, and severe deviated nasal septum. So what are the clinical features? Most important one is merciful anosmia. Okay, so patient himself is unaware of the smell due to marked anosmia. Okay, patient is not knowing that he is having bad smell from nose, and this is due to formation of crust. So air does not flow inside, and this leads to atrophy of olfactory fibers. Okay, so simply there will be merciful anosmia. The patient is not knowing, but other people like person in front of him will be knowing this, like the smell. Patient may complain of nasal obstruction in spite of unduly wide nasal chambers. Okay, so the chambers are wide, but then too he may complain of nasal obstruction due to the crust formation. Coming to examination findings, in nose, it is filled with crusts. Very important. Rheumic cavities, atrophic pale mucosa. Atrophic pale mucosa will be there, and turbinates will be small. Coming to paranasal sinuses, small with thick walls. So paranasal sinuses will also become small with thick walls. Then we can have atrophic pharyngitis and atrophic laryngitis also. What is the medical management of atrophic rhinitis? So first, we have to go for alkaline nasal douching solution. Alkaline nasal douching solution, it is composed of sodium bicarbonate, sodium biborate, and sodium chloride in the ratio of 1:1:2. Okay, I'll repeat: sodium bicarbonate, sodium biborate, and sodium chloride in 1:1:2 part. In 280 ml of water, it should be dissolved, and should be done irrigation of the nose to prevent crust formation and drying. Okay, so this solution is to prevent crust formation and drying. Then we can use 25% glucose in glycerine for irrigation. Then we can use local antibiotics. Okay, so you know that the infection mainly was Klebsiella ozynae. So in treatment, we have to give chemacetin anti-ozyna solution. Chemacetin anti-ozyna solution that contains chlormacetin, oestradiol, and vitamin D2. Then we can use estradiol spray that increases the vascularity. Then placental extract submucosal injection. Placental extract submucosal injection can be given. systemic streptomycin and potassium iodide can also be used. Okay, so see here the nutritional factors also there. In surgical management, what we need to do is Young's operation. Young's operation is mucosal flaps are elevated and completely close the nasal cavity. Okay, but here it is not that much good, because completely closing is not that good, because again there will be some difficulty in breathing. So they came with modified Young. Opening of 10 mm is still there in the nasal mucosa. Okay, so this is closed, but still 10 mm is remaining. So this is done. The principle is to narrow down the cavity, as we don't want large amount of air to go into the nose and cause crusting. Simple. So we just need to narrow down the nasal cavity. So narrowing of the nasal cavity can be done by using submucosal injection of Teflon. We can do Lawton-Slager's operation. Lawton-Slager's operation, that is section and medial displacement of lateral wall of nose. Sectioning and medial displacement of lateral wall of nose. Then we can go for insertion of fat, cartilage, bone under mucoperiosteum of floor and lateral wall of nose, thereby narrowing the nasal cavity and decreasing the symptoms. So this was about the treatment for atrophic rhinitis. Coming to 2 or 3 more entities, the first one is rhinitis sicca. Rhinitis sicca is crusting and foul smelling, but limited only to the anterior 1/3 of the nose. Okay, rhinitis sicca, here we'll see crusting and foul smelling, but it is limited only to the anterior 1/3 of the nose, but the posterior 2/3 of the nose is normal. Okay, it is due to the exposure to dry heat, very dry heat and hot climate for a long period of time, example bakers. Okay, and limited to only anterior 1/3 of the nose, causing dryness of the nose. Treatment is nasal lubricants and saline drops or saline sprays, and like if possible suggest him to like change the job if possible. Second thing is rhinitis caseosa. Okay, what is rhinitis caseosa or nasal cholesteatoma? Okay, it occurs due to chronic obstruction to sinuses and sinusitis. It is often seen in males than females. It is usually unilateral. There will be caseous type of mass is seen. Okay, caseous type of mass is seen, that is sebaceous, thick, cheesy, stubby material will be seen. The treatment is debriding the tissue and treating the cause. Okay, so this is rhinitis caseosa. So this was about the atrophic rhinitis, rhinitis sicca, and one more entity, that is nasal cholesteatoma, or we can say rhinitis caseosa. Thank you so much.